All right, continuing forward, so we just finished our full count, so now we can go ahead and start setting up our Mayo stand, okay? So the first thing I'm gonna go ahead and do is I'm gonna go ahead and load up my knife handle so I am ready for my incision, okay? So just kind of thinking of like I'm walking through the steps. So the beginning is obviously our incision. So to do so, again, I'm grabbing, I'm using a medium Mayo Hager needle holder, so the longer of the two, and grabbing my knife blade on the blunt side and then loading it onto my 3 handle, okay? And then this is going to go ahead and go on my knife handle protector. And then we have 2 blades, one for incision and then one kind of for a deep blade. So if they wanted to make further dissection and they don't, some will want a different blade. So that's why we're doing 2 blades here, okay? Now, since I have my needle holder loaded in my hand, I'm going to go ahead and load up my first procedural stitch. Okay, so that's going to be inside your needle book, just to kind of save us from suture. Otherwise, typically you would just load from your pop-offs, but I'm just loading it out of my magnet portion of my needle book. Okay, so loading it 1/3 away from the suture end or 2/3 away from the needle tip, again at a little bit of an angle. And then this is going to go ahead and just rest on the sponge portion of my needle book here on the back side of my Mayo stand. Okay. Now I'm going to continue forward with my ringed instruments, and I guess just all the necessary instruments I need. So I need 2 Kellys, and I'm always going to, as I grab these, I put them in my left hand, kind of curved down like this, so I can just kind of stack them up on top of each other, so that way they're in order. When I go over to my Mayo stand, then I have them all in order without having to adjust or fumble with them. As I put them in my left hand with the curve down, I click them once. That way when I hand them to the surgeon, they don't come springing out, okay? So just click them once. So putting them, so next I have 2 Mayos. And then I'm going 2 Alices, and these are all regular length, not the long ones. 2 Cokers, regular length. 2 Babcocks, same thing. Putting these in order. Then I'm going to go ahead and grab a right angle. And then, I'm trying to be as efficient as possible. So if one handful is too much for you, then you can make 1 trip. I'm going to try and make it all in 1 trip. So the next I have is my scissors. So I have my suture scissors, my Mayos, and then my Mets and Bombs. Okay. I'm going to go ahead and grab my Army Navies for my retractors. Okay, and I'm going to go ahead and place these on the Mayo stand before I come and grab my last thing, which is my forceps. So I'm going to grab tissue forceps with teeth, and then medium DeBakey's. Again, these are the longer of the 2. Some people get those confused. They think they're long DeBakey's, but they're actually short, or medium, sorry. Okay, and then I'm going to go ahead and continue organizing these on my Mayo stand. So there is a method to my madness. So the first thing is I'm going to go ahead and place my forceps on the front edge of my Mayo stand. So this is going to be kind of closest to my working corner. Okay, so this is front edge, this is back edge, this is edge furthest away from you, this is edge closest to you. Because remember, I'm going to be, when I pull this up to my field, I'm going to be standing on this side. Okay, so front edge, edge furthest away from me, back edge. Okay, so from here, again, I like I said, tissue forceps with teeth, and then my DeBakey's are going to the front edge. And then, again, we want to pair like items. So the next thing I'm going to go ahead and do is my scissors, because, again, we hand up scissors with forceps. And I like to alternate them like this. Okay, so I start with Mets and Bombs, Mayos, suture. Okay, and then my ringed instruments are going to come to the back edge, like so, with my curves facing towards me. So remember where I'm going to be standing. So I'm going to be standing here, so all the curved of my instruments are facing that way. Okay. Okay. Now from here, I'm going to go ahead and begin some of my ancillary duties. So the next thing I'm going to go ahead and do is load up a freehand tie. Okay. So we do that, or sorry, not freehand tie, a tie on a pass. We do that with a right angle. So I'm just going to grab a suture from my roller towel and load this. And I have a video of me recording this as well. that you can refer to. Okay, so I'm just going to go ahead and load that. And again, this doesn't really matter where you put this. I just like to put it kind of near my suture towel here. Okay, and then again, same thing with your Army, Navy. Some people like to put them after their ringed instruments. Some people like to put them before. Some people like to put them in the middle. This I don't really care about. The area that I'm picky on, again, is sharps furthest away from you. So sharps here, forceps and scissors to the front edge, ringed instruments to the back edge. Okay. Okay. Now from here, I'm going to go ahead and continue some of my ancillary duties. So from here, I'm going to go ahead and I'm going to begin loading a few things here. So the first thing I'm going to go ahead and do is load a peanut on a long Mayo. Okay, again, I don't want it to be too close to the edge, but I want it enough just for blunt dissection. And that's going to lay on the roller towel on the edge closest to my working corner. The next thing I'm going to go ahead and do is create a sponge stick. So to do that, there's a video on this too, but I'm going to go ahead and find the radio peg strip. I'm going to fold it in thirds and then fold it in half. And then again, same thing, loading this so it has a little bit for blunt dissection. Okay? And then the next thing I'm going to go ahead and do is I'm going to place 2 laps on my Mayo stand. And then I'm going to take my Edna non-perforating towel clips, and then I'm going to go ahead and prepare my cautery and suction along with my Yankauer suction tip. Okay, so I'm just going to walk over here, and whether you on this newer style or the one that has a suction piece to it, again, I don't need to prepare this at all really. All I'm doing here is just adding my Edna just to the holster. That way it's ready. And then putting this in here. The reason I don't wrap this around the cord is I don't want to kink the cautery cord, so I don't want to pinch this over top like this. Okay, so I'm just going to attach that to the holster. And then I'm going to go ahead and gather my suction tubing. And again, I can pull this out and prepare this on my field, so that way I don't risk contaminating anything. Cords are the worst, as you'll find out here soon. Okay, so I'm going to go ahead and prepare my my suction here. So the easiest way to do this is just go ahead and I grab about 2 or 3 coils, which adds up to about an arm's length. Okay, and then I'm going to go ahead and put my towel clip around the end that I'm going to stick on. So that way when I go up to the sterile field, I can just toss this off to my circulator, and I know which end that's going to stay on my sterile field. Then I'm going to go ahead and attach my Yankauer suction tip. Okay, now I prepared my suction, sorry. So I attached my Yankauer tip, and then I got the end again that's going to be staying on my sterile field, and then I'm going to come over here and go ahead and place it on the bottom below my cautery. Okay, so light handles on top, cautery, then suction. Okay? All right. Now I'm going to go ahead and prepare my Balfour. Okay? So to do this, I'm going to go ahead and grab 2 matching blades. So I'm going to say ours is a smaller patient, so I'm going to go ahead and grab the more superficial. Okay? To do this, I'm going to go ahead and load this with the wing nut facing up. Okay? And then the curve is always going to be facing away. Okay? And to do this, you see this little nut there, so that's going to always go to the back side of my of this piece here. Okay, so I'm just going to load this here. Again, the curve curving away, and then I'm going to grab my other one. Same thing, just like so. Okay, then I can close this. That way, it's ready to puncture. Okay. All right. Now I'm going to go ahead and place my drape, my laparotomy drape on top of my cords, and then I'm going to go ahead and prepare my square-offs. Again, this is listed in a specific order as far as ancillary duties go. I'm not picky on what order you go in as long as you get them done, okay? So if you happen to load your, you did your cautery first before you did, loading a peanut or something like that, that's totally fine. So what I'm doing here is just creating the square offs. Again, just folding about 2 or 3 inch fold down, and then that's the end that's going to go down, and then I just fold it in half. Okay. All right. So now I'm ready to go ahead and receive my fluids. So we're going to have saline, and then we're going to have a local anesthetic. Okay. I'll take my local anesthetic first.
Sure.
So we'll kind of walk you through this real quick. So again, you can step away from your sterile field. Yes. Mm-hmm. Or you can ground yourself as well. So she's going to go ahead and give me a local anesthetic first.
This is 1/4% Marcaine with epinephrine, 1 to 200,000. There's 50 milliliters. I'm only going to give you 30,
okay.
And it expires 4 of 28.
Okay. Perfect. Thank you. And then when we receive a med, the first thing we want to do is go ahead and make our label. So the next thing I'm going to do is I'm going to go ahead and grab my syringe. I'm going to draw up 10 cc's. I'm going to try and get these air bubbles out. The best way to do it is kind of flick it a couple of times and then go ahead and push the stopper up. And then I'm going to go ahead and attach my hypo syringe. And then I'm going to go ahead and create my labels. Okay, so when we're creating our labels, we have our labels here, our paper here. I want to stay straight up. I see a lot of people wanting to try to lean over. Remember, we don't want to do that. So again, I want to stay straight up, and then I'm going to go ahead and write out the entire name. So I'll show you this in just a second. So I'm writing 0.25% Marcaine with, I'm writing the entire word with, epinephrine as well. We don't want to abbreviate, okay? And then that's 1 to 100,000, or 1 to 200,000, sorry. And then I'm going to go ahead and make that one for, again, I have one for my med cup and then one for my syringe. So the one for my med cup, I'm going to go ahead and label how much she gave to me. So she gave me 30 cc's or 30 milliliters. So I'm going to write that on there as well. And then I'm going to go ahead and create one for my syringe. The one on my syringe just needs a label, just the drug only. Okay, so 0.25% Marcaine with epinephrine, 1 to 200,000. The reason I'm not labeling 20 cc's or 10 cc's is because I already know it's labeled here, okay, on the syringe. Okay. So the one with 30 milliliters is going to go on my med cup, and then one just listing the drug name is going to go on my syringe. I want to be careful too when I'm labeling that I'm not covering up my syringe where it says the number, so that way when I relay how much I've used at the end of the case, I can accurately do that, okay? And we always want to label after, not before, because sometimes you receive lots of medications, okay? So the next thing I'm ready for is my saline, okay? So I'll take the saline.
This is 0.9% sodium chloride for irrigation, 9 of 28.
Okay. Perfect. Okay. Same thing here, so I'm going to go ahead, I have my asepto, so I'm going to go ahead and double fill this. So I'm going to go ahead and push my stopper up, dunk it in, turn my stopper up again, push up, and then dunk in again, okay? So now I'm going to make 2 labels here as well, okay? So I'm going to go ahead and write 0.9% sodium chloride or saline. You can abbreviate this one, so NaCl, 500 milliliters. And then I'm going to create one for my asepto. Again, it doesn't have to say 500 milliliters, so I'm just going to say 0.9% saline. So the one with 500 milliliters is going to go on my pitcher. And then 0.9% saline is going to go on my asepto. Okay. Now the next steps is going to be when our surgeon is going to come in the room, and then we're going to begin draping and then the intraoperative process. So continue looking for that one.